Or do I need to?
Okay, here we are once again talking with Dr. Natelson. The reason we talk to Dr. Natelson so much is that he's involved in so much, not just in chronic fatigue syndrome, fibromyalgia, but now in long COVID. And we're talking to him about vagus nerve stimulation and the exciting study that he has going in long COVID. But first I wanted to say that we're so interested in our diseases, in chronic fatigue syndrome, fibromyalgia, long COVID, and the like, and POTS. But non-invasive vagus nerve stimulation is actually being studied in a wide array of diseases, and it's been approved to treat epilepsy, migraine, and stroke, and it's being investigated in Parkinson's, Alzheimer's, disease, rheumatoid arthritis, cardiovascular, metabolic disease. The list is almost too long to list all here. So it's really a very exciting technology, and I think it's still an emerging technology. Um, and Dr. Nielsen has had an interest in vagus nerve stimulation for quite a long time. Could you tell us how you became interested in
Well,
this?
my wife, Gudrun Lang, who you know and says hello to you,
Oh, yeah.
did a study in the early 2000s of the implanted vagus nerve stimulator in fibromyalgia. And I sort of poo-pooed that, can't do anything. But at the end of the study, a bunch of the subjects, I think we only did 13. It was a big deal. You had to bring them in, surgically implant. That's the one that's being used for epilepsy,
Uh-huh.
the surgical implanted one, and also for rheumatoid arthritis, just got FDA approved, a smaller one. Um, but what I was pretty blown away by is that about half of the patients lost the criteria for fibromyalgia. A bunch of them were able to get off opioids, which was great, and reduce their medicines. So I became convinced that VNS had a role in medically unexplained pain. And then I did a little pilot study a couple of years ago where I gave, and the reason, but we're not doing the implantable anymore because that's a huge deal. The device costs $20,000, and then you need a neurosurgeon. It's a way big deal. So I found a device that stimulates the nerve to the brain, the vagus nerve to the brain in the ear by the location of the stimulator in the ear. And I like that because in the other study I did years ago, where the person had to hold it to his neck, he only could give himself, you know, 10 minutes of stimulation because he had to go back and then stop because you have to hold it. And here with the non-invasive on the auricular nerve, you just clip it on and you're ready to go. So I like that. So I did a little pilot study, which was just gave it to patients with long COVID. And I was surprised again in that a bunch of them got better. The sickest did not get better. The most severely ill, it didn't touch. But the ones that are less severely ill, some of them got better. So we launched this follow-up study where we're using two different sets of stimulus parameters so we can pick the one that works the best.
Ah, very good. And these studies, are they being funded by Mount Sinai?
Well,
Joint-
the study that Gudrun did years ago was funded by NIH, but we were never able to get them to approve the next step. We had a reviewer that said, if you can't tell us how VNS works, and even if it works like a charm, we're not going to fund it.
I
So
see.
that ended that. And the funding for this comes from an individual donor who's been kind enough to help support my lab. And so we're devoting those funds, amongst other things, to this study.
Oh, okay. If it's successful, do you plan to reapply to NIH? I mean, do you think you'd have the data to
Well, I'm not sure what the next step is, Court.
mhm,
I mean, if it's successful, then I may just say it's successful. I mean,
mhm.
then it's up to the companies in England, uh, to what they want to do. But, that's why you do research to see what comes out the other end. So, so we've done about 30 patients and we need to do another 50, 60 patients. So
Ah,
that's
okay.
why I'm talking to you, because we had a whole bunch of patients who expressed interest, and we have a whole set of criteria. They have to have long COVID, they can't be obese. I can't remember what the other criteria are, but
Can't be pregnant. Can't be
can't
pregnant.
be, no, definitely not. Can't be wanting to be pregnant. That's right. So
Geez.
and so the way to hook up with us is to get in touch with my research nurse practitioner, Michelle, and
Mhm.
she's at 212-844-6555. That's the number for the research limb of the Pain and Fatigue Study Center.
Could you repeat that once more?
Sure,
Just in case.
212-844-6555.
Okay. And this is a 6 week study, is that right?
It's a 6 week where they don't know which one they're getting. And then the last 6 weeks, assuming they used it, they get the device that worked the best.
They're going to use it. They can use it on their own.
Well,
Oh,
no, I mean, they
then they'll
follow
be
the
they're going to be
protocol for
assessing
another
it.
six
Okay,
weeks, but everyone gets the one that worked the best.
got it, got it. And do they need to live in New York City? Or
No, that's what's great about
uh,
this. We can do it anywhere in the continental US.
oh,
We do
great.
our interviews by phone and Zoom, and then we just mail them the device. We tell them how to use it. Toward the end of the 6 weeks, we teach them to do paced breathing, breathing at a fixed rate, so we can look at their heart rate variability. And
Mhm.
heart rate variability is important because it tells you there are two aspects to the autonomic nervous system: the parasympathetic, which is calming and relaxing, and the sympathetic, which is the fight flight sort of one. And with paced breathing, quiet paced breathing, you turn on your parasympathetic. And
Mm,
we're going to see if, as we expect, the ones that are in the best group are going to have the best increase in parasympathetic tone. We'll see. That's the
interesting.
research question.
Well, just on the side, on the subject of breathing, you've used a CO2 um, monitor
We do
to
that
help
all.
breathing with your patients. Do you find that many of them are not breathing properly?
So we are just publishing a paper in chronic fatigue syndrome. And in those patients, we found, I don't remember the exact numbers, Court, but something like 25% were hyperventilating,
Okay.
and another 25% were breathing in a way that could be fatiguing. In other words, it's not quiet breathing, but it's sort of sighing in and out. And so we never expected to get that much abnormality in breathing in our CFS patients. So we're writing that up as we speak. That's the results of a NIH grant where we did the asked the patients to do 2 consecutive days of exercise so we could see how they did on that, because there's some data out there that they don't do well on the second day, and that might suggest that they have some disability. And we're just looking at that question right now.
If I mean, what would a sign um, that your breathing is apparatus is off, however it is, would be like regularly taking deep sighs? Would that
That's bad.
that's bad. I mean, if you also I
Sighing, excess. So when I'm working up a new patient, I ask, do you yawn or sigh a lot?
yeah.
And if they say yes, that's a hint that they may be overbreathing. The only way to know if someone's overbreathing, though, is to hook them up to this device that measures their exhaled CO2. Let me tell
Mhm.
you how it works.
Okay.
A normal, a healthy person, his or her cells use glucose to uh, uh, for a nutrient, and the byproducts of the cellular metabolism are carbon dioxide and water. And both the carbon dioxide and water goes into the veins, back to the heart, into the lungs. Now, if you have lung disease, chronic obstructive pulmonary disease, COPD, your carbon dioxide levels go up and up. And actually, that's what kills you when they get that high.
Mm, mm,
But with long COVID and chronic fatigue syndrome, unbeknownst to the patient, often they're moving more air than they need to. So their end tidal, the last bit of, so when this thing is on the nose, it measures the carbon dioxide that they exhale, and the last bit of carbon dioxide that they exhale is closely resembles the value in the blood. So it's a non-invasive way of seeing, of monitoring breathing and looking for overbreathing. And when there's overbreathing, the carbon dioxide goes below the norm. And of course, then the patient feels bad.
mhm.
So, overbreathing is a hallmark of some patients with CFS, and it in of itself makes someone feel fatigued and ill. So it's a target for improving the health related quality of life. And we do that. We ask them to do biofeedback. We ask them to buy a capnograph. And I found an inexpensive one that was made in China. I don't know what's going to happen with the tariffs.
Oh,
It was only $250, believe it or not. And the ones that are sold in the medical marketplace are 10 times that. So,
yeah.
but if you have it, you can sort of monitor yourself and see how your breathing is doing.
Hmm.
And then if you're breathing and you find that your carbon dioxide levels are going in the low 30s or 20s, what you can do is try to move less air. So I
Hmm.
tell the patients 4-part breathing: in, stop, out, stop, in, stop. That they should use the 4-part breathing to breathe less deeply and move less
Interesting.
air. And
Got it.
then and then if they see the number on their capnograph, then they can actually try to raise that number by breathing less deeply.
Got
So
it.
that's very important. In this paper that Dr. Mancini, who's a very famous cardiologist, I'm working with her, she's not working with me, I'm working with her on this CPET paper. And we just heard from the editors about the breathing part of the results, and we have a million things we have to address that the editor asked us about, but we're hopeful that will appear in print soon.
Oh, well, I think you guys moved pretty fast on that. What do you remember the name of the company that makes the carbon dioxide monitor?
Parasim,
Par
Parasym. That's the
Parasite.
one, Parasim. And they're in the UK, and I think I'm not sure whether they were having trouble delivering to the US, but I think they may it's possible now. Not sure. But they gave us the devices, and again, there's the different ways of programming it to test these two methods to see which is best. So that's what we're in the middle of now, Court, and was I'm hoping that your readers, regardless of where they live in the continental US, if they have long COVID, will call, let me tell you, 212-844-6555, or write, I don't remember, the email address I think is, well, let's just stick with the phone number.
Okay. So that Parasim, that's the device, the vagus nerve stimulation device you use. There are quite a few devices. I just looked it up. There are quite a few. How
Yeah.
did you choose
Well,
Parasim?
it's one that, I mean, I started this project years ago, and there weren't many then. And it's one that researchers at Oklahoma have been using to treat atrial fibrillation. So there's an indication for that now. You rattled off a bunch of possible indications, but they used this device, and I thought, um, and I use this device for my little pilot. Uh, and so I'm sticking with it, and I'm not using any other device because I don't know their characteristics, how they work, etc. So I'm pretty fussy about that, until we know more. I don't think you can just substitute any device.
No, yeah. I was looking at vagus nerve stimulating devices, and there are all these there's all these settings. There's like frequency. I saw there's something called pulse width. There's
Yep,
something called stimulation interval. There's
yep,
all these different
a lot of parameters.
combinations that
That's correct.
yeah. So um, I mean, but there is not there's no standard right now.
Well, there is. I
Or
mean,
there is. Uh-huh.
the one that comes in the device is
Uh-huh.
the one that they used in the atrial fib study. It's a standard, but I mean, right now we're not touching pulse width or any of those other things.
Okay.
Because I mean, that's, when AI moves further along, you may be able to hook a patient up and have AI determine the parameters. Right now, we don't have that
Oh, interesting.
connection, because it's just I mean, the patient's remote and there's no way to really get it, but that's possible for the future, Court. So we're pretty
Great.
excited about the VNS study. But we really need your help and that of your readers to call our lab. And then Michelle will speak to them, decide if there can be in our study, and then go through the whole research procedure of, of getting informed consent and then sending them the device and teaching them how to work it.
And is the device painful at all?
Oh, no, no. Well, here's what I tell the subject.
Uh-huh.
Raise the current until it's uncomfortable and then back off.
Back off. So
Yeah,
everybody could have slightly different
that's
currents.
that's right.
Okay.
Exactly.
Okay.
Exactly.
That's great. I was curious because I read that the that branch of the vagus nerve it stimulates the brainstem. And then it goes from the brainstem to the rest of the brain.
It's got a complicated anatomy. And
Uh-huh.
that's why if you were to ask me where it works to produce the effect, I can't answer that. I don't know for sure. It
Right.
certainly goes to descending pain centers.
Okay.
So it's possible but I mean, it's like taking a pill when you stimulate, except it's more discreet than taking a pill. When you take a pill, it can go absolutely anywhere in the body.
Hmm.
When you use vagus nerve stimulation, it only goes to the parts of the brain that are involved in pain and fatigue.
Interesting.
Yeah,
Interesting.
so
Very
that
good. Very
that
good.
helps us.
Yes, yes, the autonomic nervous system.
Exactly.
And what was I gonna? There was something else. Um, I don't know. Well, I'd like to,
Well,
but I
that's
also like
good.
to ask you, just with regard to your other your other studies. How's your NIH funding? Have any problems with funding and getting cuts
No,
or
right
anything?
now, yeah. Well, I wrote a grant about 8 months ago that was not approved. And, now I've been very lucky that my lab has a benefactor. So
Uh-huh.
that benefactor has made it so I can worry about the science and not worry about the funding.
Right, right, right.
So for now, uh, everything is good. My staff is supported by this benefactor, and we, I mean, I have a colleague whom I recruited. She's a very interesting woman. She's an occupational therapist, but she's interested in breathing and preventing frailty in elderly and gentle physical conditioning. Um,
Mm,
that it's within a person's uh, zone of appropriate effort, if you
right,
will.
right up
So
our
she's
alley.
working on that, has a grant out there. And so she needs a grant in order to get promoted.
Hmm.
Uh, that's the way it is in academe. But
Right.
right now, I'm not worrying about funding right now. And do you know Dane Cook?
Yes, yes. Well,
So
I know. Okay, yes, of
okay,
course.
well,
Yeah.
he's terrific. He and I are about to launch an fMRI study. Now, for that study, I'll explain what that is. You have to be in the New York area because you have to come in and go into the magnet. Now, what fMRI is watch. See what I'm doing now? I'm opening and closing my hand. As I do that, the neurons that control my hand start firing, and they're right here in the brain.
Uh-huh.
As they fire, they take up more glucose, and the veins around them dilate a little bit. And you can pick that up with the magnet so that when
Wow.
you do this, you can actually see those cells light up. And that's what's called functional for fMRI. So we're going to do a study, Dane and I, half at Madison and half at Mount Sinai in Manhattan, where we're going to bring long COVID patients in and have them do a task that produces fatigue and
Hmm.
see what happens to their brain as they're doing the task.
Oh, excellent.
So
Excellent.
that's not started yet. We're just about to submit that to the Human Studies Committee, and it's taken 4 months to get the paperwork perfect because, the Human Studies Committee, they want it just so.
Hmm.
So
Hmm.
we're going to submit that, and then hopefully in the next couple of months, we're going to get started. And we're collaborating with a fabulous woman, uh, Dr. Yael Jacob, who's an expert in fMRI. So she's going to be the principal investigator in that study. I'm going to help her with the subjects, identifying them both here and in Madison, and we'll see what happens.
Is this the fatiguing
No,
aspect? No, they're going to do
no,
something
this
else
is
that's
just
fatiguing, and
this is
then
just a way to tell you how fMRI works.
right,
The
right, right.
fatiguing task is a cognitive task where you get a sequence of numbers
Yes.
and you have to remember the last number that you were given. And then when they give you another number, you have to forget that number and remember the last number. So
Oh,
it's a bit of a fit. And that, if you do it over and over again and quicker, is fatiguing for anyone, but
right.
especially for a long COVID patient.
Oh, that's great. That's great. Congratulations. Is that an NIH grant?
No, sir. Again, that's funded
Oh my God.
by this benefactor.
Oh,
And he funded us so we were able to give money to Dr. Cook, and he and I put this plan together, and we're going to get started on it hopefully in the early to mid fall. So we'll keep
great.
you posted about that after it gets because it's very exciting. So
Oh,
I've got to stop now, actually,
okay.
Court. But I want to thank you for doing this and thank the people that read your wonderful writing. You do great.
No, thank you. Thank
Oh,
you.
we love it.
And thanks once again for for talking to Health Rising.
212-844-6555. Thanks, Court.
Okay. I think we're going to get this study filled.
I hope
It's
so.
too good
I,
not to be.
I
Yes.
really appreciate it. We'll talk soon. I'll keep you
Okay.
posted. Bye, Court.
Bye bye.